kind of exciting, right? Okay. And now we are going to have our Zhilin, okay? And he is from Taichung Hospital. And you will know how wonderful this person is, right? And now we have a chance to know him today. And who made the graphic designer for this doctor, and we have Zhilin from the UK, and we have more volunteers who can just finish them all together. And here, and let's just know a little bit about Dr. K. And this is really a big problem because of the sequestration. And this is dangerous that we just pass like a medicinal, and this is really dangerous for a 60-year-old lady because she coughs nonstop, and it was a problem that cannot be just cured. And we just arrange her like a physical checkup, and this is a kind of cancer, and sequestration is really something rare, and it is a problem that we can see like hemoptysis, and it may cause like a blood clotting in the lungs, right? And we don't have more than like 100 cases of sequestration, so this is really important that we have to take her left lower lobe out. And after we did this for her, and then the question was therefore solved, right? Okay. And this problem is there because of the like vein and like arteries problem in the lung.
Resect the tumors.
And this is a video about like a sequestration, and this is a big problem, right? Okay, and let's take a second video about this young man.
And for this person,
and Mr. Zhong is really
to
thankful to our medical team, and he is like a food deliverer, and he got a car accident on the way, and he got a lot of ribs broken, and we just delivered the blood over like 1,000 cc's, right? And we just realized that there was a big hole in his heart, and he was lucky because he got the blood clotting that blocks the bleeding. And when you are watching this video, don't you feel it is really touching? And we saved the young man, okay? And he was really lucky. And blood clotting actually is a bad thing, but for the young guy, it was kind of a lucky thing for him not to bleed as much as it should have been. And because of their preeminence, as Mr. Zheng Yuan comes over to Taichung, and the doctors are there for sharing some experience with Mr. Zheng Yuan. And this is a trauma that we have never seen it becoming bigger and bigger. And that is a very precious video. And the Taichung Hospital really helps patients a lot, right? And now I will be playing one more video. And this is a lady, 40-something-year-old, and she gets like a tight chest when she is too busy, and even a kind of like a pain in the heart part, right? And especially for ladies who also work may have this feeling. And she is a lady, okay, also having such a problem. And she just goes to the hospital for the checkup, and it is also because of a tumor. And the tumor is like 14 centimeters big, and it is bigger than her heart, right? And it just suppressed on her heart, right? And the tumor also suppresses her veins, and it creates a big problem. But we had to give her like a surgery. And actually, if you had a surgery and bleeding is a problem, But we are so grateful that this is the doctor that carefully just takes care of the patients who are in need, right? Okay, we really just make them understand their physical situation, and we don't know, we are laymen, but through the animations and through the videos, we really know a little bit about our physical conditions and know a little bit about what doctors are trying to tell us, right? And on the internet, and the people says it is rumored that when we are like having like evaporations, right? Okay, when we are just boiling water and it is poisonous, and the poison is like a trihalomasons, and that will just cause a lot of cancers or carcinoma. But Dr. Kerr says that no, because they are not enough, right? Okay, actually they don't cause much harm to your lungs, right? So now, ladies and gentlemen, then we have for Ke Zhilin from Taichung Hospital, and he is with us now. Okay, and because of COVID-19, and he still come over here, although COVID-19 is kind of big problem. Okay, and he can choose just speak to us online, but you see there he is, right? So this is wonderful. Dr. Ke, we love to be with you because you have a positive energy. Thank you very much. And Dr. Kerr is a really intelligent person, and I can just hear his tempo. And through such a great kind of interaction, we know little by little about the medical information. And later, okay, just now we also learned something from like a chest tightness, right? And now it is really curable. So today we can share you something healthy. Ladies and gentlemen, Dr. Ke Zhilin, okay, sharing wonderful information with us. Thank you very much.
我是台中慈济医院胸腔外科柯志林医师。那今天要跟大家分享的这个题目，是我们胸腔外科其实最专门在处理的，就是关于。
Hello everyone, all the families. Good morning, good days. I'm from the Tzu Hospital, the thoracic surgery doctors, and I would like to share with you the early diagnosis of the non-cancer and the treatments. We can talk a lot about it because the time limited, but we will focus on the early diagnosis and the treatment. First of all, we will divide it into the 4 different sections, like the early diagnosis and the minimally invasive centers developments, and also the achievement for the Tzu Hospital during the recent years. So lots of times when we're talking about the adenocarcinoma, and the patient will ask me, where exactly is the pulmonary glands? Can you show me? But most of the time, this terminology was misinterpreted because there is no pulmonary gland in our bodies, but we call that as a gland cancer. Is just part of the non-cancers, the adenocarcinoma. Well, pulmonary cancer can divide it into non-small cell non-cancer and small cell non-cancer, and the treatment is extremely different. Like the non-small cell non-cancer, the treatment will be the operation surgeries, and the other will be the chemotherapies. And the adenocarcinoma are the most common cancers, and also the other one is called squamous cell carcinoma, which is not that common. And the following non-cancer, what I would like to share with is referred to adenocarcinomas. So the non-cancer, if we can perform the surgical treatments, and we still also have to look at the stage. And usually for the stage 1 and stage 2, we'll perform the surgical resections. But when we discover that, and less than 30% of patients they are belongs to the stage 2, but the rest of the person, when it diagnosis of non-cancer, they're already in the late stage. But through the stage 1s, after the surgical resection, the 5-year survival rate is less than 60%. Even we perform the resection, but the outcome is not very well. And maybe some of them, they are inoperable. And even we perform a surgical operation, the result is not very well. So the following picture is in 2021. It's the top 10 cause of death. And through this chart, in the last 10 years, the top 10 cause of death, it doesn't matter females or males, the non-cancer is always the leading cause of death. Our insurance spend a lot of money on treating the non-cancer, but it's not able to cure. So, because it's hard to discover in the early stage, because there are no significant syndrome to diagnosis. So, is that really a way to perform the early stage discovery and to perform the treatment or screening check? For most of the time, we would think that we need to take the X-rays. For most of the laborers, usually every 2 to 3 years, they need to receive the X-ray rates. If you want to diagnose this through the chest X-ray, it is not very successful. By the time we find out the cancer, usually is a late stage. So the majority, the most important diagnosis tool is through CT scans, and it's usually operated in the hospitals. And when we talk about a CT scan, we were worried about we were exposed under the radiations. It might cause the body damage. And this pictures is we provided about every year when you receive all these different treatments, different examinations, how many millisieverts you receive through this check. So average, like when you go to the dental hospital, and the dentist X-ray, you only receive probably very low, probably 0.05 millisieverts. Or the CT, usually you receive about 7 millisieverts. So if you live in the Earth, every year you will receive about 2 to 3 millisieverts radiation amount. So all this medical treatment, all this medical examination is not really a burden of your bodies. So what is called a low-dose CT scans? Like, for example, like the one chest X-ray is equal to the amount of the taking 5 chest X-rays. So the CT scan, the mini-dose CT scan is equal to 1 millisieverts. It's less than the chest rates. So it doesn't cause much damage to your bodies. And after the CT scan, we can find the abnormal lesions. in the chest CT, such as the ground glass opacities. So it's different from what we know before. Usually the tumor should be very firm and hard, and it can grow very fast. And before we know somebody that discovered the tumor, and the tumor will keep growing and metastasize to other organs. But for this time, the ground glass opacity is not a hard or the firm tissues, and if we trace it for many years, then it did not have any change. It did not grow up at all. So that means is so after the resections, so what we understand is through the resection, we find out this is the ground glass opacity is the sign of the non-cancer. It doesn't mean that all of the ground glass opacity means adenocarcinomas. So we need a lot of check to perform the diagnosis. The first diagnosis is to define the size. If the size is over 1 centimeter through the CT scans, we have to consider the surgical resections. And if on the CT scan is less than 0.5 centimeter, most of them are the benign tumors. But if it's between 0.0 centimeter to 1 centimeters, we need to follow up regularly and clinically. If we can do it, then it's better to perform the surgical resections. We also have to refer to the family history or the smoking histories. And next, we would like to tell you about the thoracic minimally invasive surgeries. In compare with the other surgeons, the chest thoracic minimally invasive surgery is developed as a lot slower than the other departments. And this picture is taken about 20 years ago. At that time, in the thoracic surgery, we don't have any minimally invasive surgeries. And no matter how big the tumor is, we need to perform a thoracotomy and spreading the ribs and in order to get a clear view of the tumors. And we will say, big surgeon, big one. So you need to perform a big incision that's over 20 centimeters in order to remove the tiny little tumors. Is that necessary? We need to perform such a huge incisions and spreading the ribs. It was successfully removed, but the wound is still big, and also to cut the ribs, usually the patient suffer from the pains. And it's hard for them to breathe. As for the elderly patients, after surgery, that will cause the pneumonia or suffer from the shoulder breath. So the two pictures, we can see the difference from the thoracotomies. So the incision is divergent, and then on the right side, you can see this thoracoscopy surgeries with only 3 small incisions. So what exactly is the best? It's what it calls the video-assisted thoracoscopy surgeries. That means that we use the imaging to combine with the surgeries. So while we perform the surgery, we are not exactly looking at the wound, but we put the image into the monitor and we look at the monitors and to perform the resections. So we're watching the screen in order to perform our surgeries. The standard thoracoscopy, how do we provide it? How do we process this? Usually we need to separate a small incision. The one of the incision probably a little bit bigger, about 3 to 4 centimeters, because we need to resect the tumor lesions, and we need the bigger ones in order to remove the tumors. Other than that, for the recent 5 to 10 years, we also have a high resolution endoscope that we can see the image more clearly. Inside of the operation room, we have the nurse at the avant with a high resolution image. When I watch the movie and I find out our 3D image is more clearly, so for the medical, we can see more clearly through this high resolution endoscopes, and we also combine with the surgical instrument for the endoscope. This is the actual picture of the operations. And the patient will be sleeping on the sidewalk, and the anesthesia doctor will be also presented. We need the 2 screen. The surgeons will be on one side and the other assistant will be on the other side. And lots of people have so confused about the invasive surgeries. When they inquire about the surgery, they will ask, is that a minimally invasive surgeries? And is a minimally invasive surgery equal to the small surgeries? And this time I really have to explain it to them. Is that a small surgery? It's actually not. Invasive surgery is to make your incision smaller, so it's less damage to your tissues. But whatever we need to remove the tissue or the tumors, we will still clear it through it. So we can do a lot through the thoracoscopies, such as the pneumothorax or the lobectomy, or even in esophageal cancers, we can perform with the thoracoscopy surgery. It won't. So the following picture is to tell you about the development of the thoracoscopies, starting from the in year 1866. He's not really the chest surgeons. At that time, the doctor used the vast thoracoscopy to diagnose the disease. In 1910, Dr. Rob Lewis, he performed the first thoracoscopic lobectomies. And at that time, the thoracoscopic 1950, we invest the dual lumen anesthesias. Dual lumen anesthesias, we can have we can suction the air and let the lung collapse without the airs. But on the other side, without surgeries, we can insert the oxygens We can keep the patients the breathing and not influence the surgery process. So we can get a good environment. And so the recent year we can perform the lobectomy through the thoracoscopy surgeries. But because the lobectomy, we need to deal with the artery from the heart or the chest, those important tissues. So thoracoscopy can do all of these functions. So in Taiwan, we are behind the world, and like during 2000, lots of clinical hospital, we can learn more about the thoracoscopic scope. And we also learn in a foreign country how to perform the surgery. At that time, everybody started to learn how to perform the thoracoscopy surgeries. We still need 3 to 4 incisions, but in the doctor in 2010s, the Dr. Diego is the first one to perform the uniports fast. When we still figure out the 3 or 4 incision to perform the surgery, before Dr. Diego, he only need single incision to perform the operations. In 2010, Dr. Diego performed the first uniports thoracoscopic surgeries. And in 2011, our Dr. Chen performed the first non-intubated lobectomies. The non-intubated VAS means that the patient was under anesthesia. So usually we need to insert a tube into their tracheas to anesthesia the patients. Even for the general surgeries, we need to perform the anesthesia. But in the 2011, Dr. Chen Jinxin performed the first non-intubated anesthesia lobectomies. Until now, Dr. Chen is also our chairman of the thoracic surgeries. For Dr. Diego, in next year, he also performed in 2014. He also performed the first non-intubated uniport lobectomies. Because Taiwan can do it, he can also do it. So all over the world, everybody is competing with each other who can perform the more advanced surgeries. It's the developments in Taiwan about the thoracoscopic surgery. So we need a few incision, about like 1 centimeter incision plus a 4 to 5 centimeter incisions, and without spreading the ribs. Lots of people think that even 3 to 5 incision will be easier to operate it. Then why do we need the uniport thoracoscopic surgeries? So to compare the thoracoscopic surgery to the general thoracoscopy, what is the benefit of it? The uniport thoracoscopy has a better result after the surgery to reduce the pains. The most importantly is to reduce the trauma to their tissues. So that's why we perform the uniport VAS surgeries. So through this pen, for the traditional thoracoscopies, and you have to spreading the ribs, with the 20 centimeters incisions. The pain is very severe, and with the multi-port pass, and now to the uniport pass, you can reduce lots of pain to the patients. So this is the Dr. Diego Gonzalez. He's the master of the uniports thoracoscopic surgeries. So he performed the first uniports artery in 2015, the first one to perform the uniport artery resection and reconstructions. If you damage any blood vessels, it can cause the patient in crisis. And we also need to combine with the cardiosurgeons to assist with our surgeries. But the master, Dr. Diego, he can also perform this all by himself with just one incision. In 2016, he was invited to Taiwan and to perform a 2 days conference. And the 2 days conference, we have a lot of professionals, medical personnel to share their experience. But in 2016 is the first time for him to visit Taiwan. And he's the only person to give us lessons. And he's the only one that qualifies for the lessons. So I also attend the conference, and after the lessons, I was certified as a professional vest doctor. And now let's look at the Tzu Ji's achievement in the recent years. For the how we deal with the cancers, usually we see a ground glass the opacities. The lesion could be very small and the incision is very small, so it's hard to check the lesion through your finger. So the ideal way is to add the dye tracer before the surgeries. In this case, we can get a clear look, but we can, because to the dye, we can perform the resection clearly and more precisely. So we can see from the picture is seen from the thoracoscopic scopes. You can see the color in the middle. That is what we ask for the radiologists. Like before, 30 minutes before the surgery, we use the dye trace. But after the dye trace, when you see there's a blue parts, and you can know that is the place you need to remove the tumors. So this is the process of me to remove the tumors. So we inject the dye trace into the vessels, and we can remove the tumors precisely and remove it. And this is called the uniports fast surgeries. So every surgical instrument was going through this uniports. So in this case, through the pathology reports, the blue part is the blue dyes. So the lesion through the pathology was diagnosed as a stage 1 lymphatic metastasis, but it is already an adenocarcinoma. But through the surgical resection, there's no need to perform the chemotherapy, but you need to follow up in a clinic regularly. In Taichung Zhilin, before 2018, we diagnosed about 80% of 80 cases of the adenocarcinoma, but only 30% of them is operable. And in 2018, I participate in the Taichung Zhilin and cooperate with the radiology departments and take an active part to perform the thoracoscopic surgery. So every year we have about 130 cases of adenocarcinoma. So 80% of them receive the resection surgeries. And this kind of surgery no need to perform the chemotherapy, but need to follow up regularly. So in 2021, the Taichung Zhilin Hospital provided a special offer for the family and the staff to perform the low-dose CT scans, and over 300 employees received the exam, and about 10 people that discovered the lung lesions and received the surgeries. And now we have the hybrid operating rooms in the Zhilin Hospital. In the hybrid OR, we can perform anesthesias and with all the required surgery done in the same rooms. So I would like to wish everybody had a healthy lung. Thank you, everyone. Let's give Dr. Ke a big hand. Thanks for his sharings. And I can fully impress. I was very impressed about Dr. Ke Zhilin. They are very focused on your speech. When I look at them, I will also feel nervous, but today is very smooth. But when I was there, I looked at Dr. Ke. If he doesn't talk, do you think he talked very fast? He should be a very gentle person, but he talked very, very fast and very professional. I think every interpreter is very nervous because he speaks very fast, but his introduction is very thorough and he's very caring. And every PPT, he also marks. He also writes down the. So he could be very easy for the interpreter to translate it because he make a lot of notes on his PPTs. And at first, when I look at him, I thought he will be the very gentleman, but then while he's starting to talk, he's very energetic because he's very professional. He is a very popular doctor. When we listen to our professional doctors' sharings, but if it's not necessary, please don't look for him because he's very, very professional and very busy. But hopefully everybody can stay healthy. And for my friends, Dr. Ke feel amazing about your video sharings, especially the Spanish doctors. He's very young and very cool. Can we hear more about him? His name is Dr. Diego. So the other movie is talk about the movie that we all need to watch, the Avatars 2. But what we need to feel about it is the film during he shoot the films, he has to be the vegetarians. He encouraged the vegetarians. So for the Avatar episode 1, everybody watched it. The episode 2, we are really looking forward to it. And we appreciate Dr. Kerr's sharing about the pulmonary cancers. And before we share about abdominal cancers, and this time we learn more knowledge about the chest and non-cancers. We really appreciate Dr. Kerr to arrive here and make us understand the non-cancer better. With his care, we can all live a better and healthier life. Appreciate as a Tzu Chi volunteer, we just give our house to the doctor in our Tzu Chi hospital, so we have a better understanding to the diagnosis and the treatment about the non-cancers, and also have more knowledge about the minimally invasive surgeries. And the other Canada from the doctor from the other sharing. But actually, I'm not really that young anymore. I just look young, but I'm really not that young anymore. But he looks just like a oppa, like a brothers. He looks young but so professional. It's really amazing. Preventing is better than the treatments. And also the other people think that he looks very gentle and his speaking is very thorough and very detailed. So we encourage everybody to transfer your. I think Dr. Kerr is also very specialized in English. He can also answer in English. So the minimally invasive surgery can save a lot of lives, and appreciate your professionals. With the minimally invasive surgeries, a lot of people can get a very better treatments, and we can get an early diagnosis. You know how professional the Dr. Kerr is to reduce the non-cancerous pains and the fasten the recovery stage. Because your message, we really appreciate that Dr. Kerr feels very touching. And we thank you for the messages, for everybody's feedback. We hopefully in other medias or other reporter, we can encourage more medical personnel to participate this sharing.